Welcome to episode 6 in our podcast series about the National Cancer Plan. Today we're focused on primary care, and I'm joined by Dr. Richard Roop, a primary care lead for cancer. Thank you for talking with me today, Richard.
It's a pleasure.
Can you describe how primary care fits in the National Cancer Plan?
I would say that actually primary care is central to pretty much everything within the cancer plan. What's been increasingly recognised is that cancer is probably the most significant long-term condition and is now being recognised as a long-term condition. So primary care has a part to play in prevention, in early detection, in supporting patients through their cancer journey, and then looking after them as they live with and beyond cancer, and then ultimately through end-of-life care as well.
And how do you think primary care should be responding to the National Cancer Plan's ambitions?
I think favourably. I think quite a lot of them are quite tall asks, and we'll only see with the fullness of time whether they are deliverable. But I think certainly the role that primary care has to play is huge and will be very impacting, and ultimately will result in better patient care and better patient outcomes.
In Wessex, how would you say we're performing, and what does primary care need to do in order to respond to the plan?
So I think Wessex Cancer Alliance is performing really well. Certainly talking to colleagues around the country, we're regarded as one of the leading cutting edge cancer alliances, which is really affirming and encouraging. But it's on that platform, that foundation, that we'll be able to build on it in the year ahead and in the years to come. And I think particularly primary care has a huge part to play within that.
Looking at some of the sections in the plan, are there areas where there is more to be done than others?
So I think what we know is that patients who are ultimately diagnosed with a cancer through the screening programs have the best possible outcomes. And certainly if you look across all the different ways that patients ultimately enter the cancer pathway, that is let's call it the least unfavourable way to enter a cancer pathway. There's probably never a case of a favourable entry because it's always a very significant and life-changing diagnosis. But I think if we can get more and more patients engaging with the screening programs, not only will that result in earlier detection of cancers and better treatments, but will actually address some fairly major inequality issues. And I think that's one of the really encouraging parts of the cancer plan, is that real identification and acknowledgement of the inequalities that currently exist.
Recently, we've seen the publication of the Neighbourhood Framework for the NHS and communities. How does neighbourhood working fit with primary care? And how does the National Cancer Plan fit into that framework?
Yeah, so they all pretty much align, and certainly the 10-year NHS plan, which came out in the autumn, which I guess was the sort of launch pad almost for the 10-year cancer plan, which came out on the 4th of February, and the neighbourhood structures going forward, they're all on the same page. And essentially what we're going to try and do is, where it's possible to do so, deliver care closer to people's homes, which we know to be beneficial. And one of the really important things, again, on the inequity axis, it will also deal with rural deprivation and rural inequality, in that accessing centralised healthcare is a lot more complicated. There are more barriers and it's more expensive for those living further away from the big hospitals.
Where do we need to be focusing our attention in the immediate future?
So I think the first thing to say is actually affirming primary care for the great job they've been doing over the past months and years. We've seen real advances in reductions in premature cancer deaths year on year, and it's something that is not being widely publicised or promoted. So actually what is being achieved in a very demanding health environment is pretty amazing. But it's on that platform, on that foundation, that we're going to be able to build going forwards and make it an even better system, a better structure, and ultimately going for those better outcomes. So I think primary care does have a really important part to play. Very important that we're involved in the forming and norming and storming of those community care models, the integrated neighbourhood teams and integrated neighbourhood boards, or whatever acronym we're going to come up with. But really important that primary care is central to that, and also that cancer is central to that.
When you read the plan, was there anything else that stood out for you?
I think the opportunity for community diagnostic services is also really exciting. But as really across the whole plan, and particularly for primary care, resourcing is going to be one of the big challenges. And it remains to be seen, as care is in part moved from the big cancer centres and the hospitals out into primary care, whether we get that transfer of resourcing, both in terms of workforce but also funding, whether that will be aligned with it, because we will need that aligning of resourcing and funding if we're going to deliver it at scale and effectively and consistently across the whole of Wessex, Hampshire, Isle of Wight and Dorset.
And how integral is it to have that relationship with Wessex Cancer Alliance as a primary care team?
I think hugely. I think the Wessex Cancer Alliance is essentially the cement that holds the bricks together. I think it has a huge role in terms of leadership and essentially like the conductor of an orchestra, that's keeping all the different elements, the different instruments in time and focus and on the same piece of music. I think increasingly we're recognising that cancer care is becoming the barometer of the National Health Service and how effective it is. So if we have good and effective cancer care, it will reflect a good and caring NHS.
Thank you so much for discussing this topic with me today, Richard. It's been really valuable to hear your thoughts about the National Cancer Plan and the important role that primary care has and will continue to have in the success of its delivery. Join me in the next episode when we discuss the future implications in a bit more depth around neighbourhoods and the opportunity for cancer care. And thanks for listening.